A very warm welcome to every one of you. This is Henry of the Smart RN channel. In our video today, we are going to look at this condition known as heart failure. Now, heart failure is at times referred to as congestive heart failure or CHF in short. And this refers to the inability of the heart to pump enough blood to meet the body's demands. The heart works by pumping blood throughout the body. As it does that, it moves oxygen and nutrients to the various parts of the body. So in heart failure condition, that amount of blood that is pumped by the heart is not adequate enough to meet the body's demand for oxygen and nutrients. Now in heart failure condition, fluid normally collects in the lungs and the lower extremities. Because the heart is not able to move fluid in our system, there is going to be pooling of fluid in various parts of the body, and especially in the lungs and the lower extremities, in the legs and the ankles. Now, the risk factors for heart failure are the same as the causes for heart failure, because when a person develops heart failure, you come to realize that he was initially predisposed to that condition by one or more of these conditions. So risk factor number one is age. People who are older than 65 years of age stand a higher chance of having heart failure when compared to those who are younger. So the more older we become, the higher the chance of having heart failure disease. We have coronary artery disease. Coronary arteries are those ones that supply blood to the heart. Remember, the heart is a muscle, and just like any other muscles, it requires blood, oxygen, and nutrients to be able to function well. So the coronary artery is the one that ensures that our hearts receive the required amount of blood and therefore oxygen and nutrients. So when we have diseases of this or in these arteries, and especially for example, when these arteries are blocked, then there will be inadequate supply of blood to the heart, and therefore the heart's performance is going to be affected. We have hypertension, high blood pressure. In cases of high blood pressure, the heart is forced to work extra harder to pump blood throughout the body. And this causes the heart to become weakened. It causes the heart to wear out. So heart failure could result from heart hypertension. Then we have sedentary lifestyle. These are inactive lifestyles without activity. So if you are not very active, you have a chance of contracting heart failure. One reason is because blood may just pool in various parts of the body, and as such, you may have blood clots that may develop and they may affect even the heart. So sedentary lifestyle is a predisposition to heart failure. We have smoking. Now, smoking is that practice that has been cited as being a cause to many conditions that we may have. Now, heart and smoking is also a predisposition to heart failure. Why? Because smoking normally results in constricted blood vessels and especially arteries. So when the arteries are constricted, the blood pressure is elevated, and therefore the heart has to pump even harder to overcome that pressure. And as we have just said, that when the heart is forced to work harder, it becomes weakened and even worn out. We have congenital heart problems. These are problems that a person is born with. And we may have people born with various heart problems. For example, valve problem, or electrical conduction of the heart problem, or ventricular problems, atrial problems. All these problems predispose a person to heart failure. Recreational drug use, and especially cocaine. The use of cocaine normally affects the way our heart functions. We have got overweight. Extra weight will cause us to have elevated blood pressure, and the heart has to pump even more harder to overcome that pressure. The end result, as we have said, the hearts are going to be worn out, or even they're going to be worn out or weakened. We have diabetes, high blood glucose. High blood glucose, remember, it normally affects our nerves, and those nerves innervating the heart are also going to be affected because of this diabetes. So our hearts may fail due to diabetes. Hyperlipidemia. Hyperlipidemia is an increased concentration of fats in our bloodstream. Now, this normally results in the development of plaques in blood vessels and especially the arteries. So when our arteries are blocked, then the supply of blood to the various parts of the body is affected. The heart is forced to pump even harder to try to overcome this extra pressure that develops when our arteries are blocked. And another thing, when our coronary arteries are blocked, then it means blood is not going to be supplied to the heart. The end result, the heart is not going to function very well. Then you have got myocardial infarction, the death of cardiac cells due to lack of oxygen. When cardiac cells lack oxygen, they die. And these cardiac cells are the ones that help to that pump blood in our heart. The cardiac cells are the ones that help to pump blood. And when these cardiac cells die, then there is no contraction, there is no movement in our heart, and as such, we can have heart failure. Then there is diet. Diet practices, and especially increased salt consumption and increased fat consumption. Salt attracts water. Water tends to follow salt. So when we have got high salt consumption, then we are going to have increased concentration of fluid in our system. And this will cause our heart to pump even more harder. Then fats, as we have said, they might cause hyperlipidemia, which may end up blocking our arteries and as such affecting the way our hearts perform. We have got family history. There are some diseases that run in family. So heart failure could be running in a family. So if you have next of kin who have got heart failure, you stand a higher chance of contracting that disease, especially if it is running within the family. Then we have got kidney diseases. Kidneys regulate the amount of fluid in our bodies. When they fail, then we are going to have a high amount of fluid in our system. When we are looking at the renal system, we say that failure of the renal system could result in failure in other systems of the body. So be sure to review that video on the renal system. So kidney disease will cause us to have fluid problems, and this increased concentration of fluid in our system will cause the heart to pump even more harder. And we have, as we have just said, this weakens and wears out our heart. Heart dysrhythmias. Heart dysrhythmias predispose one to heart failure. For example, ventricular tachycardia, ventricular fibrillation, atrial tachycardia, heart conduction problem. All these will dispose one to heart failure. Then we have got medication, and especially cancer drugs. Remember, cancer drugs are meant to kill those unwanted cells, but they also end up killing the good cells in our bodies. So this could go a long way in affecting our cardiac cells. Cancer cells, cancer drugs can also affect our cardiac cells, and as such, our hearts will enter into heart failure as a result of these drugs. So these are the conditions or the risk factors and causes that predispose one to heart failure. So what are the signs and symptoms of heart failure? One, we have shortness of breath. People with heart failure experience shortness of breath, and this is because we have said that our hearts are not able to pump enough blood to supply enough oxygen. And one of the things that happens that these people normally wake up at night with shortness of breath. They would just be sleeping, then all of a sudden they wake up with shortness of breath because the heart is not pumping blood as it should. When they are also lying down, they have shortness of breath because the heart cannot be able to move enough fluid within our system. Then we have chest pain. This is pain that originates in the chest, and then it can be able to spread to the shoulders, to the neck, to the jaw. When you have this kind of chest pain, then be sure that this could be a cause, or this could be a reason. This could be due to heart failure. We have got heart palpitations. When the heart is racing, the heart is beating very fast, and these patients normally feel as if the heart is bursting out of their chest. So heart palpitation could be due to heart failure. Edema. This is swelling, and you may have swelling in the ankles, swelling in the legs, swelling in the abdomen, swelling even in the face. Why? Because fluid is pulling up in those areas. So edema in these areas could be a sign of heart failure. Then we have got rapid weight gain. People with heart failure experience a rapid gain in weight. Why? Because of that pulling of fluid. The extra fluid in our bodies causes them to have a rapid weight gain. Then we have fatigue. These people are fatigued, especially when they are active, because they're not getting enough oxygen supply. Then we have got weak pulses. If you feel these people's pulses, they are very weak. Why? Because the heart is weakened. The heart is not pumping as it should. And then lastly, we have pulmonary edema. This is edema of the lungs. There is fluid collection in the lungs. And this can be evidenced by the presence of crackles. When you auscultate these people with a stethoscope, you'll hear crackles in their lungs. Why? Because of that fluid collection in the lung. So what is the diagnosis? How is heart failure diagnosed? Now normally, just like with other diseases, when a person with heart failure goes to a healthcare provider, the healthcare provider will obtain health history from this patient. For example, what diseases this patient has been having, any history of surgery, any family history of diseases. So after collecting that history, the healthcare provider will now go or use one of these methods to try and diagnose if that person has heart failure. Now, method number one is echocardiography. And this is where we end up having echocardiograms. They use ultrasound to take images of the heart, to generate images of the heart just to analyze how that heart is actually functioning. Then we have coronary angiography. This is when they study the movement of blood in the coronary arteries. Remember we said that coronary arteries are very important because they are the ones that supply blood to the heart. So any problems in the coronary artery, for example, obstruction, will affect the way our heart performs. So coronary angiography helps the healthcare providers to study the movement or the flow of blood in the coronary artery. EKG or ECG, this is an electrocardiogram. That diagram that shows the electrical conduction within the heart system. So they'll take the echo, they'll obtain EKGs just to see the electrical conduction within the heart. Remember, if it has a problem, then we are likely to have heart failure. Imaging, MRI, CT scan, ultrasound, these are imaging methods that can be used to study the heart and as such diagnose this heart failure. We have myocardial biopsy, the removal of a piece of the heart to be taken to the lab to go and study the cells of that heart and be able to see if we have got heart failure. And lastly, we have lab tests. In the lab, we are going to have blood draws. And then when these go to the lab, they are going to test things like B-type, natriuretic peptide, CPK, creatine, phosphokinase, troponin. All these are normally indicate if we have heart failure. So they are going to perform lab draws to help in assessment of this particular element. So that brings us to the end of this video on heart failure. Remember to drop a comment, like this video, share this video, and if you have not subscribed to this channel, I request you to do so. From me here, it is goodbye.